Hello, it's Bill, the knee pain guru. Today we are going to talk about is total knee replacement surgery necessary for you? So if you do have questions, this is a live video. So if you do have questions, please start typing them in the comment section, and we will get to that after I have some notes I want to cover before we get into the questions. So go ahead and start typing those in the comments section. We'll address those at the end. Make sure give the video a thumbs up, like and subscribe to my channel, The Knee Pain Guru, as well as turn on the notifications so you are notified of future videos. This is a very extensive topic, knee replacement surgery. So most likely there's going to be follow-ups to this, because as I was getting into the details of it, I realized how intricate and complex. There's layers to it. Beliefs, ideas about the body, what doctors tell us, and things like that. So I realized what a complex and layered topic this is. So there will be follow-ups to this video, but for right now, we're just going to talk about the necessity for a knee replacement surgery. And I've been doing this, been involved in the knee pain industry for about 20 years now, since I blew up my own knee. And I've been doing this online for the past 10 years. So I've worked with lots of people who have been looking at a knee replacement, as well as have had a knee replacement. I have family and friends and loved ones who have had knee replacement surgeries. So I see on both sides of the equation. And the common theme that I've determined is that most people who get a knee replacement surgery choose it because they feel they have no other option, that they've exhausted all of their options, and because the doctor told them they needed one. So it's one of those situations where if you think that's the only option, well, then what else are you going to choose? You're in pain and you want to get out of pain. If the doctor tells you you need one, think about this. There's a quote that I was told growing up: if you give a kid a hammer, everything's a nail. So if you go to your surgeon and ask them, you've been in pain for a long time, and they're showing you your x-ray, the CT scan, or an MRI, and there's no space between the joint, and they ask you if you need a knee replacement surgery, well, what do you think they're going to tell you? Of course, the surgeon is going to tell you this because that's their business model. That's how they make money. So it's one of those situations, it's catch-22. You're kind of stuck with limited options, and you go outside of that box, the medical model box, and what do you choose? You look at possibly knee injections like stem cells. You have supplements that people will tell you, well, this will help regenerate cartilage in the knee. This will help relieve your pain. So you're kind of in this loop of doing things that aren't really addressing the source. So you have, I'm checking my notes here because I want to make sure I cover everything. So you have on that side of the equation, you have basically the medical model stating you have another option. You don't have another option, is you're looking at a knee replacement surgery. On the other side of the equation, I've talked to a lot of people who are like, I'm not going to get a knee replacement surgery. I don't care what the doctors tell you. Consider this. Who would say that beforehand? Like, who would honestly say, okay, I'm going to have a knee replacement surgery? That a lot of them will say, I could deal with the pain. The pain has been worse, and the pain is not so bad today. It's kind of a common theme. We live in a society. It's like, I could suck it up. I could deal with it. So you push through the pain, which is still not addressing the issue. Ignoring the pain doesn't make the pain go away, and doesn't make the knee not continue to wear. just like a check engine light that goes on in your car. If we ignore the check engine light or we put a piece of tape over the check engine light, it doesn't mean there's something wrong with the car. And you run that car long enough, eventually you're going to have to take it to the mechanic. And saying, I'm not going to get a knee replacement surgery no matter what, is kind of like saying, okay, I'll ignore the check engine light and I'm not going to take the car to the mechanic. So you're in one of those situations where it's only a matter of time that the car is going to break down or something is going to give way on your knee because there's something wearing in your knee. However, take this into consideration. Pain makes you do some crazy shit. It's just the reality of it. It's like, how many times have you snapped at family, friends, loved ones because of the pain? You've said something, you've done something that you regretted later because of the pain. It's just kind of who we are as human. Like being real about this situation with pain in the body, we have to understand there's a reality that you are experiencing this pain, and ignoring it is not going to make it go away. So if you take that you would snap at someone that you really cared about, do you really think it's out of the realm of possibility that you barely made it into the doctor's office, you're sitting on the examination table, and the doctor's like, yeah, I can get you in for the knee replacement surgery next month and we'll make this all go away? Well, odds are that's going to sound like a pretty good option. However, it's not necessarily the best option. So let's look at the only reason that you're here. The only reason that you're watching my video, the only reason that you went to the doctor to begin with. What is it? It's because of the pain. If you didn't have pain, you wouldn't go to the doctor. If you didn't have pain, you wouldn't have done a Google search to come across my video. If you didn't have pain, your life would look very different. So let's address the pain. Let's focus on the pain and not so much on the diagnosis by professionals that are saying that you need this surgery. So you begin to see how we start changing our mindset towards how we're looking at this challenge to deal with. And we start breaking it down into logical steps and going, okay, I could deal with this piece, and I could deal with this piece, and I could deal with this piece. And all of a sudden, it makes pain, the emotion, which pain is a feeling. It's an emotion, if you think about it. And that part of us is not very rational, and it'll make irrational decisions. So let's break it down and understand what's really going on within ourselves so we can start setting things up in our lives, in our knees, so then maybe knee replacement surgery isn't necessary. So I want to talk about, I was thinking about how you can actually really tell, aside from having a doctor tell you, if a knee replacement surgery is necessary for you or not. And the best way I could break it down is, do you have good days and do you have bad days? Are there days that your knees don't hurt at all? And are there days that knees hurt worse? And even more so, if both of your knees hurt, do both of the knees hurt the same? And have you had an X-ray, a CT scan, or an MRI that show both knees look the same? So if both knees look the same, well, one knee is in pain and the other knee isn't, or you have good days and bad days, then it's not so much the bone on bone or the arthritis that's causing the pain. We have to look at what is the source of the pain. And the source of all knee pain, bottom line, end of story, are tiny little nerves in your knee the width of an eyelash that are being squeezed. Some days, those nerves are being squeezed more. Some days, those nerves are being squeezed less. So in terms of understanding whether knee replacement surgery, total knee replacement surgery is necessary or not, it goes to prove, well, what if we began to change that tension pattern that's going on in the knee joint that's causing the pain, which is the whole reason why you're going to the doctor or you're listening to this video. Make sense? Now, of course, getting out of knee pain gets to be more of a belief thing than it is an actual physical mechanical thing. And there's a quote by Henry Ford that says, if you think you can or you think you can't, either way, you're right. And a lot of people will come with the foregone conclusion that I'm going to have a knee replacement. There isn't anything else I can do about it. In that case, I wish you the best of luck. This is probably not a video you're going to find very beneficial. And there's others that are looking for a solution, that really wish there was a different way of approaching it. And if the proposition of getting the bones in your legs sawed off and replaced with plastic and metal doesn't motivate you, like if you really, and I will put a link at the end of this video of the recording of a knee replacement surgery and how they saw off the bones in your lower part of your leg and the upper part of your leg and replace it with plastic and metal that only has a life expectancy of maybe 15 years, maybe 20 if you're lucky, or if you're not active. And like that would motivate me incredibly to find a different solution. So when we look at nerve irritation as being the sole source of pain, the sole source of you being here, if we begin to get the pressure off of those nerves and relax the tension in the knees, it's going to have a cascading effect on the rest of the body. And if that ultimately is the proof whether or not a knee replacement surgery is necessary or not. First, we have to look at if you have days that are worse and that are better. There's that. That's one way of looking at if it's necessary or not to have a knee replacement. And the other is if you have two knees with the same essentially diagnosis, both of the knees don't feel the same. So we have to look at the source of the pain. The source of the pain is the nerve irritation. We start getting pressure off of those nerves. The pain starts going away. Well, your whole motivation or your whole reason for making the knee replacement surgery necessary is not there anymore. So ultimately, that is your test you could do for yourself. That is going to give you an indication of a direction to look at, and using the motivation that you don't want to have the surgery to look at other options. And those could be stem cells. There's a lot of cutting edge injections you can look at in terms of alternatives. I'm probably going to get into more details on this on future videos, but ultimately it's giving you a direction to know that there are other options other than a knee replacement surgery. So I see we have some people that are on the line here. If you have questions about what's going on with your knee, please type those in over in the comment section and I will address those. For those that are watching this live or on the replay, make sure you give the video a thumbs up, like and subscribe to my channel, the Knee Pain Guru YouTube channel, as well as turn on the notifications as I will be doing future videos on this topic, knee replacement surgery, as well as other topics. So we don't have any questions, and that's okay. A lot of times they come in and I will address those. So if you see this video, the replay of this video, type in your questions, and if the question is good, I can use it on future videos as far as topics that I will be addressing. Knee replacement surgery topics as well as others. You can also head over to my website. I will put a link at the end. Take a 7-day knee pain reduction challenge. where it's showing you how to get the pressure off of the nerves in the knee that are causing the pain. You can check that out over on my website. I'll put the link in the comments section right now. And for those that are joining us, if you would like to put in your questions over on the right about your situation with your knees, there's the link to take the 7-day challenge. And that's what we got. So, once again, this is Bill Paravano, the Knee Pain Guru, thanking you so much for being here. Give the video a thumbs up, like and subscribe to my channel, and turn on notifications so you are made aware of new videos that I will be doing in the future. Head over to my website, take the 7-day knee pain reduction challenge. The link is in the chat box. It'll be in the description as well. And thank you so much for being here. Have a wonderful day, and I will see you on the next video.